My name is Kimberly Davis. I'm going to be doing the extra credit assignment, which means I'm going to be answering a few questions. How has this course allowed you to communicate with others in a professional manner? This course has allowed me to be able to effectively communicate with my team members, whether that be physicians, other nurses, CNAs, front desk staff, and things like that. Making sure that I'm adequately giving the information that's needed to make sure that, like I said, I'm meeting them in a professional manner, and it's also effective. With effective communication, it can decrease the possibility of miscommunication. But the great thing about communication is, even if there are some miscommunication, you can always, just go back, talk to them just to get some clarification. And communication is always forever changing, whether that's be verbally, whether it's electronically. Communication is always going to be the best thing when it comes down to the medical profession, and specifically in nursing. How has this course allowed you to apply principles of therapeutic relationships and professional boundaries when working in a group? So when it comes down to working in a group, it is effective to make sure that we are applying every single principles there are to therapeutically in these therapeutic relationships. We want to make sure that we are respecting boundaries of other team members as well as our patients. And this is going to help make sure that we are being an effective team. If I'm not meeting my patients where they are, then that's not going to be helpful for my patients, because we have to meet them where they are. We don't want to speak over their head and things like that. We always want to use layman's terms to make sure that we, like said, they're getting what they need from us as the nursing staff, as well as making sure that other team members are aware of what's going on. We are doing everything we can to be an effective team. How has this course allowed you to engage in peer evaluation? So in this course, we did a discussion board post, and with our discussion board post, that means that we would discuss a different topic. As for an example, I would discuss something of my own. I would bring in the information that I feel as if I understood with the assignment, and other classmates would then add or take away from what I gathered from my assignment. So they would do those things, and I would do the exact same with their assignments. So we would go over a topic, give our references. They would, give me feedback, and also, like I said, take away from the assignment and do the same. This is very helpful because I may look at a situation totally different from the next person. Not saying that what I gathered from the assignment was different or wrong. It just means that we all look at things differently, and it allows us to, see the way that our other peers are are thinking, which is helpful because no one thinks the same. Even though we're all nurses and we can see a situation, we're all going to assess it differently. How has this course allowed you to recognize and demonstrate the core values of your profession, of your professional nursing identity? This course has allowed me to look at other nurses as for nursing theories, the roles of a nurse, research of other nurses, and it allowed me to see the type of nurse that I am, the type of nurse that I want to be, and the way that we can look at nursing as a profession as a whole, and the way that if we take care of our patients this way, we can prevent rehospitalization. How we can be sure to perform the roles as a nurse to effectively care for our patients, to effectively give the information needed from the physicians or nurse practitioners and things like that. It makes me want to be a better nurse. I mean, my goal is always to be a better nurse, be the best nurse that I was the day before. Nursing is always evolving. There's always room for just to be better as a nurse. You know, we always strive to be the best that we can be. And with that being said, nursing is always changing. It means we should always be evolving, and that's why like evidence-based come into foreshadow, because things are always changing. Things that worked 10 years ago, it may not be the same 10 years from now. And these things are things we discussed in this class. And it changed the way I feel about nursing and made me want to be the better nurse in the future, and also helped me further my education as well. How has this course allowed you to demonstrate respect for diverse individual differences and diverse communities and populations within a group setting? This course has allowed me to look at every individual as a whole. With that being said, I can't take care of a patient, a African American patient in New York the same way I would an African American patient in the South. I can't take care of a Muslim male the way that I would a female Muslim. We have to meet every single patient where they are, and everything is individualized. Even if we have patients of the same faith base, that doesn't mean that they are the exact same within that faith or within their religion. We have to always remember to meet every patient where they are, and it's always respect. We want to decrease the barriers that are always going to be present with our patients. Ones that are in a more rural area, we have to treat them as if they're in a rural area. We can't speak to them as if they are neurosurgeon and they're going to understand everything that comes out of our mouth, because they're not going to. If they're elderly, they're not going to understand certain jargon. And so, like I said, we have to meet them where they are. And that's really when it comes in, that to me is also comes into play with communication, because we are decreasing the barrier to make sure that we meet everyone where they are. This course has been very informative. It has helped me. Of course, I'm still not 100% comfortable writing papers and things like that, which is, it will come to me eventually in the time to come. But this has been like a very informative course to take. I really enjoyed it, and I'm hoping that the rest of the year while I'm in this program, I hope that every other course is just as informative and just as exciting as this one was. I thank you, and hoping for good next semester.